Hello everybody, my name is Dr. Ahmad. Today I wanted to talk a bit about dark circles, the causes of them, the potential treatments of them. It is an involved process, but I thought today I'd give you a brief synopsis and a summary. The causes of dark circles include an anatomical variation of the orbital ridge. Now this is the orbital ridge up here, and in some people it protrudes forward, what we call an anterior protrusion. It comes forward, and because of the depth of which it comes forward, it actually creates a shadow under the dark circle here, so it looks as if you have a dark circle when really you have increased shadowing from your bony structure. Another common cause is sleep deprivation. Everybody knows about that. You wake up in the morning, your eyes look tired, and you know, if you make this a regular habit, a perpetual habit, this will have a long-term effect on your eyes. As we age, we lose volume. You know, you'll notice that the eyes start to hollow out over here. We start to lose the fat pads, and as the bone sits on as the skin sits on the bone, you will notice that it starts to get darker. Now look at the color of the skin that has a lot of fat under it, and look at the color of the skin which actually has lots of fat and it's sitting on the bone, which will give a darker appearance. Another cause is a lack of vitamins, a lack of minerals. These are things that are required for a healthy skin, and we lose these through what's known as oxidative stresses. These are part of the pollution process, the things we're exposed to in our food, the additives, a part of life in general, and these things are all in there, and they have their effect on the skin. The skin is the largest organ in the body. It's like, you know, it's 8 to 9 kilos in body weight. It varies in its depth, its texture throughout the whole body, with the thinnest skin being under your eyes and the thickest in the heels of your skin. So therefore, being the thinnest skin, it will have the greatest changes visible in it as well. Other causes include pigmentary changes. Some people develop post-inflammatory hyperpigmentation if they've had trauma, or some people due to excess sun exposure, particularly those with darker skin types, will have some pigmentary changes here. Another common cause is a loss of blood supply, a poor blood supply. As we age, or for various factors, we start to lose the blood supply, and the skin just becomes dull, it becomes sluggish, it becomes lifeless. Now, our treatments are designed at treating the root cause. And it's very important to realise that unless we are treating the root cause of the problem, we will not get anything that is longer term or something that is sustainable. It's not, when you're coming in for an aesthetic treatment, you have to remember that there is, you know, it's not like going in for a beauty facial or a beauty whitening makeup or something. This is actually a medical treatment. Now, behind our treatments, there are scientific studies, there's evidence-based medicine, which actually proves how some of these treatments work. And we actually are able to, you know, we back our results, we take responsibility for our results, because we use combination therapies to optimize the outcome for our patients. Now, what sort of treatments are involved in dark circles? It can be a combination of using different types of laser for rejuvenation of the eye area, for improving the texture of the skin, for decreasing the amount of pigmentation in the skin, for giving firmness to the skin, to give it a fuller feeling that's there. We also use some mesotherapy products which are infused into the skin, whether it's with PRP or with mesotherapy additives, which include your vitamins, your minerals, your amino acids, everything that the skin is lacking. We talked about the oxidative stresses and damages that are occurring, to replace and to replenish that. In addition, we have mesopeels that we use on the surface, again, to tighten and firm the skin, to lift the superficial discoloration, to help improve the texture and the appearance of the skin.